On behalf of everyone here at NJ Life and Health, we want to thank you for choosing us for your Medicare needs. This video is a casual and easy to understand guide that will help you with the basics of your Medicare Supplement Plan G. If you want a more thorough breakdown of your coverage, we emailed you a Plan G guide that will give you more detail. We know all this can be incredibly confusing, and we hope this short guide can help you through your Medicare journey. The first thing we have to talk about is that original Medicare is your primary insurance, not your Plan G. People think their Plan G does all the heavy lifting, but it's really your red, white, and blue Medicare card. Your Medicare A and B card determines your doctor's network, the procedures available to you, and pays 80% of your medical costs and then some. Your Plan G is paying the remaining 20% and a few other out-of-pocket costs. The only thing you're responsible for is an annual $257 deductible, which once you hit it, there should be no bills past that point. When you go to the doctor or make an appointment, say you have original Medicare, give them your red, white, and blue Medicare card, and then give them your Plan G. This will lead to less headaches for everyone. Now you might be wondering, what does original Medicare and your Plan G cover? As of 2023, 98.9% of doctors in the US accept original Medicare. It works on a federal level across state lines. If you need a surgeon or a specialist in another state, or if you break your leg on vacation, you will most likely have coverage. Your Plan G makes zero decisions about the doctors you see. It is again all original Medicare. Original Medicare covers the vast majority of medically necessary procedures in inpatient and outpatient settings. Things that are covered include doctors and specialists, most routine blood work, chemotherapy and immunotherapy, orthopedic surgeries, hospital stays, durable medical equipment, CAT scans, PET scans, ultrasounds, MRIs, heart surgeries, cortisol shots and other injections, most cataract surgeries, and many, many more things. If your doctors use the right codes and it's deemed medically necessary by Medicare, there is little red tape or pushback. You won't have to worry about fighting with an insurance company to get the procedures that you need. Now, some things original Medicare doesn't cover include cosmetic procedures such as weight loss and plastic surgery, LASIK eye surgery, long-term nursing homes or long-term home health aides, dental, prescriptions, and eyeglasses and eye exams. Prescriptions are administered through a separate Medicare Part D plan. Standalone dental and vision policies are optional add-ons. So you're gonna have your red, white, and blue Medicare card and your Plan G whenever you go to the hospital or a doctor's office. Then you're gonna have a separate Part D plan that you'll use at the pharmacy. You might be wondering what your costs are. Original Medicare and your Plan G have virtually no lifetime limits on covered procedures. You could rack up hundreds of thousands of dollars in bills, but only pay your annual deductible. The only exception that exists is the 365-day hospital reserve days, which kicks in after Medicare's 90-day hospital coverage beyond the standard 60 lifetime reserve days offered by Medicare Part A. Many people ask us when they should expect to pay their annual $257 deductible, and we can tell you with absolute certainty we have no idea. Most people will reach their deductible around March or April, depending on how often they go to the doctor. Many won't reach it at all. Now, if you're ever billed over $257 over the course of the year, 9 out of 10 times this is a mistake and would warrant a call to the provider for explanation. It is almost always a coding error, and if the doctor's office or provider's office can resubmit the bill, it is most likely going to lead to the bill going away. I know we mentioned this earlier, but we have to hammer this point home. Your Plan G carrier doesn't matter. It doesn't determine your doctors or covered services. It is standardized by the federal government, and insurance companies can't change the structure or benefits of a Plan G. We say this because if someone you know says they have one that is better, they are mistaken. It's the same coverage. A Plan G is a Plan G is a Plan G, no matter what company you get it from. Now, some people ask about switching Plan Gs. So the first thing we're going to tell you is as long as you pay your premium, you can never be kicked out of your Plan G, no matter how many bills you accrue. Your Plan G will increase in price slightly every year. If after a few years you want to find a lower price, we may try to switch you to a different carrier. This requires good health but is fairly straightforward. You will not sacrifice coverage when you switch to a different carrier. Now we're going to cross this bridge when the time comes, but just know you shouldn't be afraid of switching Plan Gs in the future if you are eligible. Original Medicare combined with your Plan G boasts a nationwide doctor and hospital network. This means you can travel domestically and not have to worry about any emergencies that may come up. Your Plan G also offers some international travel coverage. It will pay for 80% of your international medical costs after a $250 deductible with a $50,000 lifetime limit. Note this is only valid the first 60 days of your trip. We still recommend getting traveler's insurance when possible. Cruise ships have weird rules related to medical coverage, and you're probably going to want to get temporary insurance there as well. Now this is a quick overview of what your Plan G does, and we hope this helps you better understand Original Medicare and your Plan G benefits. We are always here to answer your questions, and we welcome suggestions for other Medicare-related topics that you'd like us to cover. So thank you so much again for choosing NJ Life and Health for your Medicare needs, and we look forward to working with you for many years to come.